Canadians have a healthcare system of which we are proud. In fact, 94% of Canadians consider it an important source of national pride. And there's a lot to be proud of. Our system provides excellent care while balancing resource expenditure. We spend roughly half as much as our American counterparts, and our healthcare system is higher in global rankings.
One of the fundamental concepts of our healthcare system, envisioned by Tommy Douglas, is that healthcare is universal. He proposed that any Canadian, no matter the province or territory in which they live, should have access to the healthcare they need, free of charge. And in 1966, our government took the big step of giving every Canadian universal healthcare coverage. Our system has developed into one where anyone, regardless of location, race, gender, or socioeconomic status, has access to care. Anyone should have the ability, if they're sick, to walk into a hospital and get the treatment they need.
Except for one important thing: prescription drugs. Whether it's antibiotics to help you get over an infection, an asthma inhaler to help you breathe during physical activities, or an EpiPen to help prevent fatal allergic reactions, these prescription drugs aren't covered under our healthcare system except in hospitals. The cost Canadians pay for essential medication is increasing every year. Last year, we spent $30 billion trying to fill over 600 million prescriptions. In total, prescription spending is 4 times higher than it was 20 years ago, and the cost of prescription drugs in Canada are quickly increasing. Between 2000 and 2012, our prices increased at a greater rate than any other comparator country.
And Canadians keep spending more and more money on prescriptions. Canada currently spends the most money on pharmaceuticals compared to similar countries with universal Medicare systems. In the last 5 years, we've wasted $15 billion on overpriced prescription drugs, and over 80% of new prescription drugs entering the market today don't even offer any medicinal advantage compared to drugs already covered on drug plans. Canadians pay about 22% of our drug costs straight out of our own pockets, not counting what we spend on insurance premiums. The rest is covered by a confusing patchwork of 19 public and 24 private insurance providers, all with different eligibility criteria and different coverage levels depending on where one lives or works. So much for treating everybody equitably.
3.5 million Canadians don't even have basic prescription drug coverage. These people usually live in the poorest neighborhoods and have the lowest levels of education. They're more likely to be young, women, recent immigrants, and working part-time. The health of Canadians can actually be predicted by factors such as poverty and education levels, housing standards, access to transportation, access to good quality food, and so much more. People who are not well off or more likely to have serious health problems. These are called the social determinants of health and speak volumes to the inequity of our current healthcare system. Not surprisingly, a third of people with incomes under $50,000 didn't take the drugs prescribed to them last year because of cost. Overall, 1 in 10 Canadians can't afford to fill their prescriptions.
Luckily, there are a few things we can do to change this. We can stop the rising costs and make sure everyone has access to the medicine they require. We can join many other public healthcare systems in the world by covering prescription drugs in the exact same way we already cover healthcare. It's not that complicated. With a universal national Pharmacare program, we can use our government's influence to negotiate bulk purchasing and reduce overall costs. We can make sure that everyone who is sick is treated based on their needs and not on their ability to pay. No one should have to choose between paying their rent or filling their prescription.
We can make our healthcare system truly the best in the world for all Canadians, no matter where they live, where they work, or what their education level is. It would be a large investment, however, it would have an even larger reward. We would be helping to improve the inequities created by the social determinants of health in Canada, and in the process improve many lives. Pharmacare will put us one step closer to being on the leading edge of global healthcare. Currently, 91% of Canadians already support Pharmacare. So what are we waiting for? This really shouldn't be such a tough pill to swallow. It's time to make our healthcare system truly universal, public, comprehensive, portable, and accessible. And that sounds like something to make us truly proud.